I've got one that can see.
Health and Human Services Secretary Robert F. Kennedy Jr. says he is removing the CDC's recommendation for children and healthy pregnant women to get the COVID-19 vaccine. And a new variant of the virus has made its way into the U.S. The strain is now being reported in at least 4 states, including California, Washington, Virginia, and the New York City area. Let's bring in Dr. William Schaffner. He's an infectious disease expert and professor of medicine at Vanderbilt University Medical Center. So, doctor, I mentioned this new variant comes at a time when the FDA is also planning on limiting access to the COVID vaccine come the fall, demanding new trials. How significant is today's announcement about the removal of this recommendation for children and pregnant women?
Well, Lindsay, the removal of the recommendation for younger persons and pregnant women is a top-down recommendation. You know, normally we give recommendations to the CDC's Advisory Committee on Immunization Practices, and they then send that recommendation up through the CDC director to the secretary. And that system has worked very well for over 60 years. And so we're in a little bit of uncertain turf here about how recommendations are going to be made going into the future. Now, let me say quickly that the CDC's Advisory Committee is scheduled to meet in June. And actually, their discussions in their previous meeting looked to me as though they were moving in an entirely similar direction. So at the moment, I think the availability of vaccines for younger persons and for pregnant women, just as the COVID summer surge is about to begin, is a little bit uncertain about whether insurers will pay for it.
Let's talk about COVID summer surge, the possibility of. Is that because of this new variant, or is that because in summers past we've also seen an uptick in cases? And what can you tell us about this new variant?
Yeah, and for several summers before, we've had a summer, midsummer, late summer surge in addition to the winter surge. It's like a 2-hump camel that we have. This new variant appears to be a member of the Omicron family, just another cousin, if you will, to those Omicron variants that are going around. Does not appear to be more severe, is likely to be contagious, and the currently available vaccine is likely to continue to provide protection against severe disease. So that's very reassuring.